Hey everybody, Miss Mary here. So I asked and you answered. I asked, what did you want to see as far as videos? What did you want to hear me lecture about? And I got a lot of great responses, nursing care plans. And I have a video coming up next about that. One was about GI, which I will be happy to do too. And one of them was requested for immunology. So vaccines, transmissible diseases, PPE associated with that stuff. And that's what we're going to do today. So this video and the PowerPoint that I created to go along with this, the video is going to be available, of course, on YouTube, but it's also going to be available on my new website. And if you become a member, what you will have access to is all my cheat sheets, PowerPoints, cheat sheets, everything that I have created over the past 5 years to help you reach your goal. You will be able to have access to on my new website. So stay tuned. There's more coming about that. All right, let me share my screen and let's talk about immunology because that is what you wanted to hear about. So what are we talking about when we talk about immunizations? We're talking about what the CDC recommends as far as immunizations and what are required by the CDC for what age groups. And then we're also going to talk about the different transmissible diseases and how they're transmitted, because you will have questions about that on the boards, okay? As well as any exit exams that you're going to be required to take, I promise. So that being said, let's pull up this PowerPoint for you guys and let's see where it brings us. And here we are. So this is called Immunizations, Transmissible Diseases, and Precautions. All right. And I'm going to pull this up as a slideshow so that it's nice and big. I'm going to do it right from the beginning. This way you can see everything that you need to see. Pretty groovy, huh? All right. So immunizations, transmissible diseases, and precautions. What are we talking about? So when we talk about immunizations, what we want to know how immunizations work. So it's not a magic trick, okay? When you get a vaccine against a specific disease, what we're giving you is a little bit of the virus, the actual disease, and it's either live or it's inactive. So, and most of them are not live. Most of them are inactive, okay? And if you have a healthy body, a healthy immune system, and it's working the right way, in about 2 weeks, give or take, your body will produce antibodies to that particular disease. So if you ever get exposed to it, you're not going to get sick, okay? So like I said, most of these vaccines are inactive, but there are 5 that are live that you've got to know about. And the 5 that are live: measles, also known as rubeola; mumps, also known as mumps orthorubeolovirus. That's a mouthful. Rubella. Don't confuse rubella with measles. Rubella is German measles, different disease. Varicella, chickenpox, and then herpes zoster, also known as the shingles, okay? So what's the difference between a live vaccine and an inactive vaccine? When we give you a live vaccine, we're giving you an actual little bit of live virus. So if a patient's pregnant or if they're immunocompromised, can't get a live vaccine. And when we say immunocompromised, what does that mean? Many students have said, well, immunocompromised is like an autoimmune disorder. No, an autoimmune disorder means that they have plenty of white blood cells, but instead of attacking foreign objects, which is what our white blood cells are supposed to do, their white blood cells are attacking them, right? Attacking their own stuff. So multiple sclerosis, lupus, sarcoidosis, rheumatoid arthritis, type 1 diabetes mellitus. These are all autoimmune disorders. It doesn't make the patient immunocompromised, so don't get that twisted, all right? Immunocompromised means that they're neutropenic, so they don't have enough white blood cells. So who would that be? Anybody that's got cancer, leukemia specifically, because that's cancer of the blood, that makes you immunocompromised. But any other cancer, it's not the cancer that destroys your immune response, it's the treatment. So chemotherapy and radiation are, suppression to your bone marrow. They're myelosuppressive. When you suppress the bone marrow, Bone marrow is where your cells are made, white blood cells, red blood cells, and platelets. So if I suppress your bone marrow, you're not making white blood cells, and therefore you're immunocompromised, right? Makes sense? Okay. Anybody that's HIV positive or has AIDS, immunocompromised. Anybody that's on medications other than chemo that can be myelosuppressive. So the first one that pops into my head is glucocorticoids, corticosteroids like prednisone, methylprednisolone, right? Any steroids, corticosteroids or glucocorticoids will over time, if used for greater than say 3 months, they're going to suppress your bone marrow and thereby cause like a Cushing's syndrome. Okay. In other words, you will become immunosuppressed. So you can't have a live vaccine because if you get it, you're going to actually contract the disease. Makes sense, right? So now let's talk about transmission of diseases. When we talk about transmission-based precautions, it means how is the disease spread from person to person? And what precautions do we have to take so that we don't get sick? So first one is airborne. Airborne diseases are, I want my MTV, measles, tuberculosis, and varicella. Those are airborne. And what that means is they're micro droplets. So that if I'm in a room and I have tuberculosis, I don't have to laugh or cough or sneeze or do anything. I can just breathe. And those tiny micro droplets spread through the air. So anybody that's in that room is now exposed. And then they're likely to contract it. Okay. So what PPE do we need for those airborne diseases? Measles, tuberculosis, varicella. The nurse needs an N95 fitted particulate respirator. Okay. Not a one-size-fits-all surgical mask. It's a fitted mask. The patient needs to be alone in a negative pressure room. And what does that mean? That means that the air that's exchanging in the room is actually getting sucked out into a special HEPA filter that filters out the diseased air, right? So that it doesn't get spread into the general population of whatever facility the patient's in, okay? Patients shouldn't really leave their room, but if they must, surgical mask on the patient and N95 on the nurse, okay? That's airborne. Then we have droplet. So any disease that's respiratory, but is not measles, tuberculosis, or varicella, is going to be droplet. So pneumococcal pneumonia, respiratory syncytial virus, RSV, that's a pediatric thing, bronchitis, influenza, respiratory MRSA, pertussis, there's a ton of them. They're respiratory diseases and they are transmitted via droplet. Droplets are macro droplets as opposed to the micro ones with airborne. In other words, they're bigger and you have to laugh or cough or sneeze, or when you're talking, maybe you're spitting a little bit. And within a 3 to 6 foot area around you, those people would be susceptible, all right? And PPE would be a surgical mask. That's it. A one size fits all is all you need. You don't need a gown. You don't need a NASA suit, okay? So that's droplet. Then we have contact. Just like the name implies, if it's contact, it's got to come in contact with someone. So if somebody, say, has a wound, and it's infected with MRSA. Well, if you touch it, you have an open area, you touch it without a glove on, that's contact, boom, you can contract the MRSA. VRE, vancomycin resistant enterococcus. I know that's a mouthful. VRE is just another super bug, kind of like MRSA, but it's found in urine specifically, all right? So you would never go and empty a Foley drainage bag without gloves, right? Hepatitis is all of the hepatitis are contact, really, because hepatitis A, just remember, hep A, HA, hand, ass, it's oral fecal, okay? I know that's a weird way to remember it, but that's how you can remember it. So oral fecal means you went to a restaurant, the cook has hep A, he went to the bathroom, he didn't wash his hands, and then he gave you your food. Right. Or the other way is raw food, shellfish, especially. So like clams on the half shell, oysters, those kinds of things that aren't cooked. Okay. And then you have the hepatitis B and C. Now there are other hepatitis, but don't worry about them. For all intents and purposes, these 3 are the ones that you need to know. So hepatitis B and hepatitis C, They're transmitted through blood and body fluids. So in other words, with blood, we're talking about people that are drug addicts and sharing needles, okay? Body fluid. Body fluid would be vaginal secretions, semen, right? Urine. So that's when we say contact, that's what we mean. So if someone has hepatitis B, then you would not, have unprotected sex with them or share a needle with them, right? And if you know you're going to be exposed to any kind of fluid that's, whether it's urine or feces or vomit or any of that, you would protect yourself by wearing gloves, maybe a gown too, right? Okay. HIV is contact, same thing, blood, body fluid. Scabies, right? Pediculosis, which is lice. C. diff, Clostridium difficile. We know that's typically in the stool, okay? The STD, sexually transmitted diseases, syphilis, gonorrhea, right? They're all transmitted, we say unprotected sex, but that's contact, right? Because of the body fluid, the semen and the vaginal secretions, okay? So what do you need? You need gloves and you possibly need a gown. You might even need something more than that, but that's clinical judgment. So in other words, you definitely should have on gloves and a gown. But if you know that you're going in to irrigate a wound that's infected with MRSA, and you're going to be turbulently irrigating it and it might splash, wouldn't you want goggles, right? So just keep that in mind. That's clinical judgment. But what is required is the gloves and the gown, right? Because you don't want to touch whatever it is that's infected, okay? Then we have what we call universal precautions or standard precautions. So what it means is that everybody got something, all right? So if you know that you are risking coming in contact with somebody's blood or any of those body fluids, you need to wear gloves. Now, keeping that in mind, if you're just doing vital signs on patients and they don't have open seeping wounds all over them, you don't need gloves, right? There's a lot to be said for the human touch. It really does help make people feel better. But if there's a chance that you're going to be coming in contact with some kind of blood or body fluid, you must wear gloves, okay? Then we have neutropenic precautions, which you will also see called reverse isolation. Because here's the thing, with standard precautions and the other three, airborne, droplet, and contact, we are protecting ourselves from that patient's disease. And by protecting ourselves, we're protecting all our other patients too, right? Well, with reverse isolation, neutropenic precautions, we're protecting that patient from us, okay? Because that means they have such an immunocompromised status, their white blood cell count is so low, if they caught a cold, they could die, okay? And so just remember, no fresh fruit, no fresh vegetables, no uncooked or undercooked food. So in other words, no sushi, no clams on the half shell. Those things are uncooked and potentially could carry bacteria, mold, spores, fungi, all sorts of things. So can't have those, can't have fresh flowers, can't have live plants. All right, they should avoid crowded places, but if they have to go somewhere, they need to wear a mask when they go out, okay? And just FYI, for uncooked, undercooked food, a hard-boiled egg is okay, right? Because it's a hard-boiled egg. A soft-boiled egg, if you don't know what that is, it's very bougie, very fancy. It's called a 3-minute egg. It's still gooey on the inside. So a soft-boiled egg is served in this little egg cup, and you tap it to take the shell off and slurp the inside. That's not cooked, okay? So they can't have that. All right, and moving on. This I got from the CDC, and it's just about donning and doffing PPE. Donning means putting it on. Doffing means taking it off. Remember this. When you're donning it, you always do your hand hygiene, and you see the order. You're going to put on your gown, you're going to put on your mask, your goggles, and then your gloves go on last. Well, it's the opposite when you're taking off PPE, when you're doffing it, because the dirtiest thing comes off first. And what's the dirtiest thing? Your gloves, because you're touching things, right? Gloves come off first, right? Then the eye protection, and then the gown, and then anything, if you have any kind of a mask on, and then of course, always hand hygiene, okay? And that's a board question. All right, now we're going to get to the actual immunizations. Now, here are the ones that you absolutely need to know. So first, we have the flu shot, influenza. It is given starting at 6 months of age, and everybody should get it every year no matter what. The only contraindication to the flu shot would be an anaphylactic reaction to eggs. In other words, you cannot come anywhere near an egg, or acute febrile illness. In other words, they're sick with a very high fever. We would wait till that fever and that illness goes away before we give them the flu shot. But a mild illness with or without a low-grade fever, they can still get the flu shot. Okay, it's not a contraindication. So, and adverse effects would be erythema, redness, or pain at the injection site. And by the way, erythema and pain at the injection site and malaise and myalgia. Malaise means I feel kind of crappy, and myalgia means I'm kind of achy. Okay, those adverse effects hold true for all the immunizations, all of them, and none of them are a reason to not get immunized. Okay, and immunocompromised and pregnant patients are the first ones that should get the flu shot because they need that protection. It is not live. Next, you have your MMR. That one's live, okay? And that covers measles, mumps, and rubella. And usually it's given in 2 doses, usually at 12 to 18 months of age and then 4 to 6 years of age. And if they're allergic to gelatin or neomycin, can't have it. If they're pregnant or immunocompromised, because it's live, can't have it. Pneumococcal pneumonia, that is a one-time dose after age 65. That's all, you need it one time. And the only contraindication would be if the patient is allergic to the diphtheria vaccine, which we're getting to. Okay, so pneumococcal pneumonia for older folks, one-time dose recommended by the CDC after age 65. Then we have varicella, chickenpox. That's a live one. Remember, 5 that are live, MMR, varicella zoster, okay? Varicella is usually given 11 to 12 months old, and then they get a booster between 4 and 6 years of age. And again, it's live, so if they're pregnant, nope. If they're immunocompromised, nope. And if they're allergic to neomycin or gelatin, nope. Now, sometimes you'll see the MMR called the MMR2 or the MMRV, which means it's MMR and varicella all in one shot. Doesn't really change much. They're all live. So anybody who's immunocompromised or pregnant shouldn't get it. And then we have the DTaP, which is what we call it for infants and children. And then it's the Tdap for adults. But what we're talking about is diphtheria, tetanus, which is also known as lockjaw, because your jaw actually will lock up. It's terrible, neurological. And then pertussis, which is whooping cough. So it is given at 3 doses are given, 2 months, 4 months, 6 months. Then they get a booster at around 15, 18 months. And then 4 to 6 years of age, they get a booster. But remember this, every 10 years throughout your adult life, you should be getting the Tdap. Okay. Contraindication for this would be any history of Guillain-Barré disease, which is a neurological disease, or within 6 weeks of receiving the vaccine, having contracted Guillain-Barré, or if they have unstable encephalopathy, which is encephalo meaning brain, apathy meaning it's broken, any problem that causes a change in their level of consciousness or cognitive status of their brain, or active seizures, then they should not receive the Tdap until that's resolved. Okay, but remember, every 10 years for the Tdap as an adult. Then we have HPV, and that's the human papillomavirus. And that virus is known to cause cervical cancer in females and either anal or penile cancer in males. So nobody wants that. You give it to males and females, 11 to 26 years of age. Okay. The only contraindication would be if you are allergic to that particular vaccine or any of its components. Other than that, you should get it. Hepatitis B series. So we give it to the newborn. That's the first immunization that they get before they leave the hospital. And then they get their second dose in 1 month. And the third dose is 6 months from the first dose. Any contraindications to this would just be the same as the other, allergy to the vaccine or its components. Other than that, hepatitis B. You don't want Hep B. Hep B is right up there with HIV. So that's one of the nasty ones, okay? It can kill you. Next, herpes zoster, also known as the shingles. So that shot is recommended by the CDC to be received by adults over 50 years of age. It's a one-time dose. The new one is called Shingrix. Now, for years, Zostavax was the shingles vaccine, but we don't get that anymore in the US. So now Shingrix is the one being used. That's just FYI. I don't believe the board's going to ask you about it. And then contraindications for this, again, 5 that are live, would be if they're pregnant, lactating, or they're immunocompromised. They shouldn't get it. It's one of the 5 that are live. Then we have the meningococcal conjugate. So meningococcal bacteria is the one that causes meningococcal meningitis. You don't want that because that can have some bad results. It's a bacterial meningitis. It can be very, very dangerous. So this meningococcal conjugate vaccine is given to kids somewhere between 11 and 12 years of age. They get a booster at around 16 years of age. And this has no contraindications other than an allergy to it or any of its components. And then I gave you 2 links to the CDC's actual schedule for vaccinations that includes all the other ones like polio, et cetera. But, you know, if you want more information, there's the adult link, and then there's the child and adolescent link for you. And that is the end of this lecture. Not really, there's going to be more. All right, guys, until next time, I will see you soon, and I hope you enjoy this. And again, you're going to have access to this PowerPoint on my website if you become a member coming soon. Bye.